Now, just as we have turned the corner in living with COVID-19, we're facing another, hopefully lesser threat, Japanese encephalitis. And this week, we learned that cases of human infection have been recorded across parts of Australia of this potentially deadly virus. It's caused by the spread of mosquitoes. The virus usually has no symptoms, but in rare, serious cases, it can cause swelling in the brain and even death. The outbreak has already been declared an incident of national significance by the Acting Chief Medical Officer. For her analysis, I'm joined now by the Chair of Epidemiology at Deakin University, Professor Catherine Bennett. Welcome to the program.
Hi,
Cases
Sherry.
of Japanese encephalitis are rising with the exploding mosquito numbers that we've seen as a result of the floods and the wet weather. While there have only been a handful of cases so far, should we expect this to rise dramatically?
Well, some of the cases we're hearing about now are older cases. They've now had the alert that you can expect to see this Japanese encephalitis potentially further south in Australia than we've seen before. So they have gone back to look at recent cases of encephalitis just to see whether they can isolate the virus. So some of this isn't new cases. Some of this is recognising cases that have been diagnosed previously with encephalitis. So we do have to worry about the mosquitoes. They are the risk here. That's what will potentially transfer the virus from pig farms where they have isolated the virus. But it's really important that hand in hand with all of that concern and public health messaging for us, so avoid mosquito bites, cover up, use your repellents, particularly if you're out camping. Take that protection from mosquitoes really seriously. At the same time, they're going out and checking particularly piggeries, which is the other animal we worry most about. Water birds can spread the virus via mosquito vectors, particularly into the pig population, and they can be there in such large numbers. It's the mosquitoes biting those water birds or the pigs that have enough virus in them to then potentially transfer it to a human. So they're the reservoirs we have to really watch, where you can get large numbers of animals infected, particularly in a piggery. So they're also vaccinating the workers in those places to protect them, and they're isolating those pig farms until they've cleared the infections. So they're managing that risk in the environment, but it's also important in the meantime we really do try and manage that mosquito risk because the numbers are up, as you say.
Look, for my understanding is that for most people, there might not even be any symptoms, but in rare cases, this can be very serious. Are there particular demographics or age groups who are the most vulnerable here? Who's at risk?
We don't have a clear picture on that because the case numbers here are very low. We know we've had young babies infected and we know we've had adults. So it can depend on the infecting dose. It can depend on a range of factors. But you're right, it's a very small percentage of people that just get that severe enough disease resulting from their infecting dose that leads to this encephalitis. And once you're in that group, then you are at a high risk of being hospitalised and being quite unwell. But at the same time, they are less than 1% of the population. The good news, compared to COVID, where we worry about asymptomatic cases and they might spread to other people, even if a mosquito bites a person who has the virus, is asymptomatic, that mosquito can't pass it on to another adult because the person who has the infection isn't carrying enough virus in their bloodstream to give that infecting dose to the mosquito to actually pass it on. So we're reassured actually in this case that we do have asymptomatic cases, and that's most people's experience. But if we don't know exactly what puts individuals at risk, and the number of infections and potential reservoirs, the number of pigs who are
Yes.
infected was as high as it was, with at least 21 facilities impacted, then that's where you do start to see enough people with serious illness that the alerts go on and
Yes.
up, so that we react.